through the 8th, we had a total of 476 cases reported. If you compare that with a month ago, October 12th through the 18th, we had 280 cases reported for that week. So we've had almost a 200 case increase within the last month. The previous week, October 26th through November 1st, we had 417 cases reported, and October 19th through the 25th, 343. So going backwards, you can certainly see a steady increase in the number of cases. This does not compare to the peak that we saw in July, where we saw a really sharp increase in the number of cases. And that's why it is so very important that we continue the non-pharmaceutical interventions, the facial coverings, as Commissioner mentioned, as well as that social distancing, more than 6 feet apart, and the appropriate hand hygiene and other hygiene practices. That's really and truly, folks, our only defense. There are some people who are asymptomatic. There are some people mildly symptomatic, but then there's those who become critically ill and unfortunately some who die. So we're trying to protect as we've mentioned before, our families, our neighbors, our friends from contracting this virus and from spreading it, and thus also allowing us to keep our businesses open by these practices to protect those around us. So as far as the congregate settings, we're working very closely. As I mentioned, we have weekly calls with our hospitals partners. We also have weekly calls with our nursing home long-term care facilities, along with the medical director, Dr. Todd Husty, and the emergency manager, Alan Harris, and his team, to address any unmet needs, whether it be personal protective equipment, new guidelines that are coming out, testing, and so forth. The requirement for facilities, nursing homes to test that was lifted several weeks ago, probably about a good month ago now, and those that are funded by Medicaid, Medicare under CMS guidelines, they are still required to test according to our positivity rate in the community. So if we're over 5%, they have to test more frequently, which is what they're doing currently. But there are those facilities that are not under the CMS regulations, and they have reached out to the county as well as the health department for assistance in testing. So I am proud to say the county has been extremely supportive in those facilities, making sure that they have adequate resources to test, according to the guidelines and appropriately. We also, from the health department, send in teams of our healthcare acquired infection epidemiologist to assess for infection control practices, to do some training, and we have done that from the beginning, and we will continue to do that to protect that vulnerable population. In our schools, we communicate daily with our schools, and we are seeing a little bit of an increase in cases in our schools. 282 cases have been reported so far, mostly in students, 209 students, 76 staff, and 1 visitor over the course of this response. We have seen, although the majority of these cases are community acquired, we have seen minimal evidence of transmission within school settings, and we're working very closely with the schools to make sure that we are able to minimize that as much as possible. Just as with our other congregate setting, the long-term care facilities and nursing homes that we spoke of. Also in any of our jails or correctional facilities, juvenile detention, anywhere where we're seeing congregate settings, there is a potential for increase in cases. So we remain vigilant with that as well. So far in Seminole County, we've had a total of 909 cases reported in pediatrics, or children. And of those, the majority of them are in 15 to 24-year-olds, 2,222 cases to be exact, with 16 hospitalizations within that age group. And so that is our university college age as well as high school age. And so we're working very closely with our neighbors, other county officials surrounding Seminole County to make sure that those messages get out and the mitigation to prevent the spread of the virus as well. Just want to touch real quick on, I know I've mentioned it before, but the percentage of deaths that are occurring in our county, the majority are in those age 75 to 84 years of age. That's 73% of reported deaths in our county. The next is 65 to 74-year-olds, the next highest, and that's 16% of our deaths reported are in that age group. The others, 35 to 64 years of age, make up 11% of the deaths reported in Seminole County. We are fortunate that we have not had any deaths to date in those under age 35 years of age in our community. So hence the importance of our continued vigilance. I want to talk a little bit about the vaccine. As many of you heard, the announcement yesterday from Pfizer is very encouraging, but preliminary data, certainly indicates that the vaccine candidate it seems to be more than 90% effective in preventing COVID-19. That's really high, like I said, encouraging, but there's more studies that need to be done before we're even at the point of vaccine distribution. And there are several measures in place that assures the safety and efficacy of any vaccine that's manufactured, whether it be for COVID or anything else. And so there's an advisory committee on immunization practices that once a vaccine is approved by the emergency use authorization, FDA emergency use authorization, those recommendations will come forth to make sure that we ensure safety and when we administer to our community. And so there are also such things from the government as vaccine adverse event reports and other reporting systems in the event that even after a vaccine comes forward, we assure that if there are any side effects, that those get reported timely, and we make sure that those are minimal. If not, then certainly the researchers and scientists will revisit. As far as when vaccine will be available to our community, that's everybody's been asking, and certainly that will assist in keeping the spread of this virus from occurring. The priority groups that have been identified, as far as we know to date, with the information that we're receiving from Health and Human Services, is the hospitals, the healthcare workers, and other essential workers, and those that I mentioned in those vulnerable populations in our long-term care facilities, nursing homes, and ALFs. So those would be the populations that the vaccine will be available first. As far as the general public, it appears that vaccine may not be available to the general public until after the first quarter next year. So you're looking at March, April timeframe. And that really has to do with the extreme volume of vaccines that need to be produced nationwide, globally, actually, not just nationwide. And so if you want to see the vaccine plan from the Florida Department of Health is posted on the Florida Health COVID-19.gov website. And so that plan was distributed from the HHS plan, or Health and Human Services plan, subsequent to that being released. The county and the health department, as well as many of our other partners, have worked very closely over the last several weeks to prepare for the receipt of the vaccine. And I'll let Alan Harris speak a little bit more to that, as far as what we are doing collectively to make sure that we are prepared to administer the vaccine as soon as we receive it to our high-risk population as well as the general public. Just want to leave you with a reminder as holiday season comes about. I know that many of us want to get together with family and friends. We're not saying you can't, but just take precautions. Limit the number of people who meet in one location. There's guidance out there from the Centers for Disease Control and Prevention that just came out yesterday, as well as some information on the health department's website, seminole.floridahealth.gov. Just some gentle reminders on what you can do to protect your loved ones as you come together for the holidays. So with that, I'll turn it over to Alan Harris, our County Emergency Manager.
All right, thank you, Donna, and thank you, Chairman. This is day 243 in the Emergency Operations Center here at Seminole County, and we're continuing to monitor, of course, the cases of COVID. And our basic stance today, of course, is the numbers are going up here in Seminole County. It does have us concerned. It is not going up at the level it was going at the last spike, but it is going up enough that has us concerned. And that's why we wanted to do the press conference today. We know that because of some of the actions that people have taken, most of the people in Seminole County have taken, that is the reason that we're not seeing the spike as exponential as it was the last time. And we hope people will continue to do the right thing to protect their friends, their family members, their coworkers. We are doing what we've done since day one. We are continuing to support the assisted living facilities and nursing homes. We're continuing to support individuals that are isolated and quarantined in their homes. Individuals that some right now may have economic challenges, so they can't get food delivered to them. We're supporting those individuals because they can't leave, they can't go to the grocery store, they can't because they're sick inside of their homes. We call those individuals every day. The numbers of active cases here in Seminole County just 3 weeks ago was just in the mid 300s, now over 700 cases in the county active individuals with COVID-19. Individuals isolated and quarantined in the home was down. That includes the persons that have come in contact with COVID down to the 500s just about 3 to 4 weeks ago, and now we're flirting with 1,000. We're near 900, or mid 900s. So obviously that puts a strain on our community. So I want to thank again, and the chairman already has, but I want to thank our nonprofit organizations that have provided us those food products that we can provide to the individuals that are isolated and quarantined in their homes. While we're responding to the incident, of course, we're preparing for the future, and we're preparing for the future by making sure that we are ready once the vaccine starts to get distributed to our community, that we can distribute that to the individuals that need it. The healthcare workers, those people in assisted living facilities and nursing homes. So we've purchased items to help with that, where we may have open points of dispersing, where we'll be giving out pharmaceuticals to individuals, vaccines to individuals in an open environment where the public can come. And then closed points of dispensing where we're giving those out to targeted groups like our assisted living facilities and nursing homes, healthcare workers, first responders, law enforcement officers, firefighters, individuals as such. We aren't going to stop. We are going to continue our operation, and we know that it's taxing. And we hope that people will take heed as it goes into the holiday season, but we also understand that people need the spiritual and mental support of the family members during this crisis. So we hope that everyone has a very, very safe holiday season. Well, I'm sure we'll be talking prior to that. But I want to talk about another holiday, and of course that's the holiday tomorrow, and that's Veterans Day. And we want to thank all those that have served our country so valiantly. Tomorrow we will have our offices closed, our libraries will be closed, our main offices will be closed in honor of Veterans Day, and we honor everybody that has served our country. I want to thank those in Seminole County that have served our country, as well as specifically some of the employees that are going to continue to serve even tomorrow. Some of the first responders that have served our country, but they're also working tomorrow in those first response activities. On another front, we must talk, it's unfortunate, but we must talk about the hurricane season. And that is that very happy that Tropical Storm Eta did not turn into a hurricane as forecasted and is not moving in our direction.